Um, I went to a meeting of our national professional organization, the American Association for Public Health, and there was a subgroup of that organization called the Gay and Lesbian Health Workers Caucus that I joined. And it was made up largely of folks who worked at or volunteered in gay clinics like Seattle Gay Clinic and Whitman Walker Clinic and Howard Brown Clinic. And we had a discussion there that kind of made my ears stand up, because the director of our STD program at my public health department, Hunter Hansfield, and I'm not talking out of school because Hunter and I are still good friends and all this is long ago, but he had written an editorial to the Journal of the American Public Health Association journal, in which he argued that gay clinics were counterproductive and in fact were keeping people from going to public health centers and they shouldn't be supported. And so here we were at this caucus meeting discussing my colleague's letter, which had just been published. And so I thought, I'm going back to Seattle, I'm talking to Hunter to see where this is coming from and what this is all about. And so I went back and I met with them and said, you know, you need to know that the Gay Caucus is really upset about this, and we talked about you, and you're going to hear about it. And he said, oh, well, I guess I'm, you know, they can write letters, whatever the heck, but I, you know, I mean, what I said, I'm worried that these gay clinics are going to keep people from coming to public health department clinics. So indeed, he got a bunch of letters, and I met with him again, and I said, well, Hunter, if you feel that strongly about gay clinics, why don't you come and volunteer for a couple of weekends with us and see what we really do? And he did. He took up that challenge, and he came and he volunteered and he watched and came away with a completely changed mind, that he realized we were able to do a quality service. It was limited. We could only do what we could do as volunteers, and with the help of volunteer doctors and volunteer nurses and supplies that we were able to buy from the public health department, et cetera. But he had a different take on it, and his response, once it was time for these letters to get published in the AGPH journal, was, well, we really ought to work together with these freestanding gay clinics. So he called into being an advisory group that we met once a month with the STD clinic staff and with Hunter at the public health department to talk about how we could collaborate and maybe supplement some of the services at the gay clinic and make sure that we were doing appropriate referrals from the gay clinic to the public health department. So it took on a whole new flavor at that point and was less confrontational, I guess I would say. And you know, some of the folks at the gay clinic who'd had bad experiences like I had, you know, had a chance to learn more about public health and vice versa. And I kind of viewed myself as a little bit of a bridge between the two worlds. So we were able to supplement our services.